Emma had always considered herself a healthy, active woman. She enjoyed running, ate a balanced diet, and had never struggled with significant health issues. But then, in her early 30s, things began to change. Her periods, which had always been regular, started to become irregular. She gained weight despite her healthy lifestyle and struggled with mood swings and persistent fatigue. She also noticed more acne on her face and back, something she hadn't dealt with since her teenage years. Confused and frustrated, Emma visited her doctor, who diagnosed her with a hormonal imbalance. Emma's story is familiar to many women. Hormonal imbalances can manifest in various ways, affecting not only reproductive health, but also overall well-being. Understanding the impact of hormonal imbalances on women's health is crucial for recognizing the signs, seeking appropriate treatment, and taking steps to restore balance. This presentation will explore what hormonal imbalances are, their common causes, how they affect women's health, and the solutions available to manage them. What are hormonal imbalances? Hormones are chemical messengers produced by glands in the endocrine system that regulate various bodily functions, including metabolism, growth, mood, and reproductive health. In women, key hormones include estrogen, progesterone, testosterone, insulin, thyroid hormones, and cortisol. These hormones must work in harmony to maintain balance and proper bodily function. A hormonal imbalance occurs when there is too much or too little of a particular hormone in the bloodstream. Even small fluctuations can cause significant changes in the body, leading to various symptoms and health issues. Hormonal imbalances can affect women at any stage of life, from puberty to menopause, and are influenced by factors such as age, lifestyle, stress, and underlying health conditions. Common causes of hormonal imbalances. Several factors can contribute to hormonal imbalances in women. Understanding these causes is essential for identifying potential triggers and taking preventive measures. Puberty. During puberty, the body undergoes significant hormonal changes, with increased production of estrogen and progesterone. These changes are normal, but can lead to temporary imbalances that cause symptoms such as irregular periods and acne. Menstrual cycle. Hormone levels naturally fluctuate throughout the menstrual cycle, with estrogen and progesterone levels rising and falling. However, some women may experience more pronounced imbalances that cause severe premenstrual syndrome or irregular periods. Pregnancy and postpartum. Pregnancy involves dramatic hormonal shifts to support fetal development. After childbirth, hormone levels drop rapidly, which can lead to postpartum depression, mood swings, and other imbalances. Menopause. As women approach menopause, estrogen and progesterone levels decline, leading to a range of symptoms, including hot flashes, night sweats, mood swings, and vaginal dryness. Polycystic ovary syndrome, or PCOS. PCOS is a common endocrine disorder that causes elevated levels of androgens, or male hormones, in women. This imbalance can lead to irregular periods, excessive hair growth, acne, and infertility. Thyroid disorders. The thyroid gland produces hormones that regulate metabolism. Conditions such as hypothyroidism, or underactive thyroid, or hyperthyroidism, or overactive thyroid, can disrupt hormone levels and lead to weight changes, fatigue, and mood disturbances. Stress. Chronic stress triggers the release of cortisol, the body's primary stress hormone. Elevated cortisol levels can disrupt the balance of other hormones, including estrogen and progesterone, leading to symptoms such as anxiety, insomnia, and weight gain. Diet and lifestyle. Poor nutrition, lack of exercise, excessive alcohol consumption, and smoking can all contribute to hormonal imbalances. Certain foods, such as those high in sugar or processed fats, can lead to insulin resistance and affect other hormone levels. Medications. Certain medications, including birth control pills, hormone replacement therapy, and some psychiatric drugs, can influence hormone levels and cause imbalances. Underlying health conditions. Conditions such as diabetes, obesity, and autoimmune disorders can affect hormone production and lead to imbalances. Symptoms of hormonal imbalances. Hormonal imbalances can cause a wide range of symptoms depending on which hormones are affected. Some of the most common symptoms experienced by women include irregular periods, changes in the menstrual cycle, including missed periods, heavy bleeding, or unusually light periods, can indicate a hormonal imbalance. Weight gain or difficulty losing weight. Hormonal imbalances, particularly those involving insulin, thyroid hormones, or cortisol, can lead to unexplained weight gain or difficulty losing weight, especially around the abdomen. Mood swings and irritability. Fluctuations in hormones such as estrogen and progesterone can cause mood swings, irritability, and even depression or anxiety. Fatigue. Persistent fatigue that doesn't improve with rest may be a sign of a thyroid disorder or adrenal fatigue, both of which involve hormonal imbalances. Acne and skin changes. Hormonal imbalances, particularly elevated levels of androgens, can cause adult acne, especially on the face, chest, and back. Other skin changes, such as dryness or increased sensitivity, may also occur. Hair loss or excessive hair growth. Hormonal imbalances can lead to thinning hair or hair loss on the scalp, known as androgenic alopecia, or excessive hair growth, known as hirsutism, on the face, chest, and back. Sleep disturbances. Hormonal imbalances, particularly those involving cortisol and melatonin, can disrupt sleep patterns, leading to insomnia or poor quality sleep. Hot flashes and night sweats. These symptoms are commonly associated with menopause and are caused by declining estrogen levels. Low libido. Hormonal imbalances, particularly low levels of estrogen or testosterone, can lead to a decreased sex drive or sexual dysfunction. Digestive issues. Hormonal imbalances can affect digestion, leading to symptoms such as bloating, constipation, or diarrhea. Breast tenderness. Cyclical breast tenderness is often related to hormonal fluctuations during the menstrual cycle, but persistent tenderness may indicate an imbalance. Infertility. Hormonal imbalances, such as those seen in PCOS or thyroid disorders, can interfere with ovulation and make it difficult to conceive. Hormonal imbalances can have a significant impact on various aspects of a woman's health, affecting not only her physical well-being, but also her emotional and mental health. Here's how hormonal imbalances can influence different areas of health. Reproductive health. Hormonal imbalances are a leading cause of irregular menstrual cycles, infertility, and conditions such as PCOS and endometriosis. These imbalances can affect a woman's ability to conceive and maintain a healthy pregnancy. Bone health. Estrogen plays a crucial role in maintaining bone density. A decline in estrogen levels, such as during menopause, can increase the risk of osteoporosis and fractures. Heart health. Hormonal imbalances, particularly those involving estrogen and cortisol, can affect cardiovascular health. Estrogen has a protective effect on the heart, and declining levels during menopause may increase the risk of heart disease. Chronic stress and elevated cortisol levels can also contribute to hypertension and other cardiovascular issues. Mental health. Hormonal imbalances can significantly affect mood and mental well-being. Fluctuations in estrogen and progesterone levels can contribute to mood swings, depression, and anxiety. Thyroid imbalances can also cause symptoms of depression and cognitive changes, such as brain fog. Metabolic health. Hormones such as insulin and thyroid hormones are essential for regulating metabolism. Imbalances in these hormones can lead to weight gain, insulin resistance, and an increased risk of type 2 diabetes. Skin and hair. Health. Hormonal imbalances can cause changes in skin texture, acne, and hair loss, or excessive hair growth. These changes can affect self-esteem and confidence, particularly for women dealing with adult acne or hair loss. Sexual health. Low levels of estrogen or testosterone can lead to a decrease in libido, vaginal dryness, and sexual dysfunction, affecting a woman's sexual health and relationships. Digestive health. Hormonal imbalances can affect gut health, leading to symptoms such as bloating, constipation, or diarrhea. Hormones such as estrogen and progesterone influence gut motility and the balance of gut bacteria. Diagnosing hormonal imbalances involves a combination of medical history, physical examination, and laboratory tests. The process may vary depending on the specific symptoms and suspected hormonal issues. Here's how hormonal imbalances are typically diagnosed. Medical history and symptom assessment. Your healthcare provider will take a detailed medical history and ask about your symptoms, including their onset, duration, and severity. They may also inquire about your menstrual cycle, reproductive history, stress levels, and lifestyle habits. Physical examination. A physical exam may include checking for signs of hormonal imbalances, such as acne, hair loss, excessive hair growth, or weight changes. A pelvic exam may be performed to assess reproductive health. Blood tests. Blood tests are commonly used to measure hormone levels and identify imbalances. Key hormones that may be tested include estrogen and progesterone. To assess reproductive health and menstrual irregularities. Testosterone. To check for elevated androgen levels, which can indicate PCOS or other conditions. Thyroid hormones, TSH, T3, T4. To evaluate thyroid function and identify hypo or hyperthyroidism. Cortisol. To assess adrenal function and identify stress-related imbalances. Insulin and glucose. To check for insulin resistance and risk of diabetes. Saliva tests. Saliva tests may be used to measure certain hormone levels, particularly cortisol and sex hormones. These tests can provide insight into the body's circadian rhythm and stress response. Imaging studies. In some cases, imaging studies such as ultrasound, MRI, or CT scans may be ordered to assess the ovaries, adrenal glands, or thyroid for structural abnormalities that could contribute to hormonal imbalances. The treatment and management of hormonal imbalances depend on the underlying cause, the specific hormones involved, and the severity of symptoms. Here are some common approaches to managing hormonal imbalances. Lifestyle modifications. Diet. Eating a balanced diet rich in whole foods, including fruits, vegetables, lean proteins, and healthy fats, can help regulate hormone levels. Avoiding processed foods, sugar, and trans fats can reduce the risk of insulin resistance and other hormonal issues. Exercise. Regular physical activity can help regulate hormones, reduce stress, and promote overall well-being. Aim for a combination of cardiovascular exercise, strength training, and flexibility exercises. Stress management. Chronic stress can lead to elevated cortisol levels, contributing to hormonal imbalances. Practice stress-reducing activities such as swimming, walking, meditation, deep breathing, and mindfulness. Sleep. Prioritize getting enough restful sleep each night, as sleep is crucial for hormone regulation. Aim for 7 to 9 hours of sleep per night and establish a consistent sleep routine. Medications and hormone therapy, birth control pills. Combined oral contraceptives can help regulate menstrual cycles, reduce androgen levels, and alleviate symptoms such as acne and excessive hair growth in women with PCOS. Hormone replacement therapy, HRT. HRT may be prescribed for women going through menopause to alleviate symptoms such as hot flashes, night sweats, and vaginal dryness. HRT involves the use of estrogen and progesterone to restore hormonal balance. Thyroid medications. For women with thyroid imbalances, medications such as levothyroxine for hypothyroidism or antithyroid drugs for hyperthyroidism can help regulate thyroid hormone levels. Metformin. Metformin is commonly prescribed for women with PCOS to improve insulin sensitivity and regulate menstrual cycles. Anti-androgen medications. Medications such as spironolactone can help reduce the effects of elevated androgens, including acne and hirsutism. Natural and complementary therapies, herbal supplements. Certain herbal supplements, such as black cohosh, chasteberry, vitex, and evening primrose oil, are believed to support hormonal balance. However, it's important to consult with a healthcare provider before using supplements, as they may interact with other medications. Acupuncture. Acupuncture is a traditional Chinese medicine practice that involves inserting thin needles into specific points on the body. Some women find that acupuncture helps regulate menstrual cycles, reduce stress, and alleviate symptoms of hormonal imbalances. Mind-body practices. Practices such as nature walks, hiking, tai chi, and mindfulness meditation can help reduce stress, promote relaxation, and support hormonal balance. Regular monitoring and follow-up ongoing care. Women with hormonal imbalances should have regular follow-up appointments with their healthcare provider to monitor hormone levels, assess symptoms, and adjust treatment as needed. Preventive screenings. Regular screenings for conditions such as diabetes, cardiovascular disease, and osteoporosis are important for women with hormonal imbalances, particularly during menopause. Emma's path to balance. Finding solutions and restoring well-being. After being diagnosed with a hormonal imbalance, Emma began her journey to restore balance and improve her health. With the guidance of her healthcare provider, she made significant lifestyle changes, including adopting a healthier diet, incorporating regular exercise into her routine, and practicing stress management techniques like nature walks and meditation. She also started taking birth control pills to regulate her menstrual cycle and alleviate her symptoms. Over time, Emma noticed significant improvements in her mood, energy levels, and overall well-being. She learned to listen to her body, prioritize self-care, and seek support when needed. Emma's experience taught her the importance of understanding hormonal health and taking proactive steps to maintain balance. Hormonal imbalances can have a profound impact on a woman's health, affecting everything from her reproductive health to her mood and energy levels. Understanding the causes, symptoms, and treatment options for hormonal imbalances is essential for managing these changes and maintaining overall well-being. If you suspect you have a hormonal imbalance, don't hesitate to seek medical advice and explore the various solutions available. With the right approach, it is possible to restore balance, improve your health, and lead a fulfilling life. Remember, your hormones are powerful, but with knowledge and care, you can take control of your health and well-being.